Hey everybody, this is Dr. Nicole Williams once more. We are happy to see everybody here once again to our Candid Vag Talk. It's so important to be able to kind of go over all of these things and get rid of so many of the myths that still exist with every single patient almost that I see, especially when we're talking about fibroids, because there is a lot of myths out there and we really want to be able to dispel these myths. So before we get started though, however, we must see what tasty beverage we have today, which is so important. So today I have, this one is Brown Estate. It's a Petite Syrah from 2016. Lovely. Brown Estate, just so you know, I have nothing to do with their business, no financial anything whatsoever, but Brown is an African-American owned winery in Napa. It's only, I think there's only like 4 or 5 actually in Napa. This is one of the good ones. I've been there, fantastic. So yay. Okay, well, cheers. And now let us go and talk about some uterine fibroids here. Wait, we have to cheers. Yeah, still good. It's a couple days old, but you know, sometimes if a wine breathes, just wonderful. So anyway, let's go and talk about fibroid mythology and fibroid truth. And guess what? I actually have Dr. Pierre on, and he's going to join us in a little bit. But I'm going to go over a few things that we can kind of go, okay, this is what fibroids are. This is how they work. This is how they happen. So I'm going to share my screen here. And what are fibroids? So this is from our website. And here, I'll just kind of go like that, and then you'll see. So this is from www.gynecologyinstitute.com. So feel free to go and have a look. So do you have fibroids, first of all? So what are fibroids? Fibroids are usually benign tumors that live in a woman's uterus. Why do we get them? We don't know, but we know that there is some kind of strong genetic component, and we do know that African-American women do tend to have fibroids. One of the reasons why we don't know as much about fibroids as we should is that since it's a woman problem, and more often than not, a woman of color problem, research dollars from the NIH are not going to go toward this. But there have been some really great companies out there, you know, coming up with different things to try and attack these tumors and get all of us with fibroids living better lives. So just to show you, these are the different types of fibroids that you can see. There's one that's a subserosal fibroid. That's the thing that's on the skin of the uterus itself. And then if you're looking at this one's kind of hanging off a little bit. That's called a pedunculated fibroid. And that one just hangs off. It's not necessarily here. It just can be anywhere, but it's hanging off. This one's under the skin. And an intramural fibroid is in the meat of the uterus. And then you can have a submucosal fibroid. Now, those fibroids are the ones that are kind of living inside the cavity where the babies would be. Then when we go to this one, this is a different type of submucosal fibroid, and that's like a pedunculated fibroid kind of in the lining of the uterus. So fibroids can cause terrible, awful symptoms. We know it's awful, and you can cause bleeding, pelvic pain, really, really, really bad cramping, pelvic pressure. I've had women come in with urinary issues because the tumors get so big that they just don't have as much space and they actually feel pregnant. Here, let's get rid of this screen here. And we usually diagnose them, of course, we all know you diagnose it with an ultrasound or an MRI. Kind of depends. If you have really big ones, we need to see if it's squeezing something. We might actually want to do an MRI. Okay, so we'll stop that. And I think I have a couple other screens I want to share. Oh, this is a much nicer picture of the fibroids. So you can see that a lot better. So these are your subserosal fibroids, pedunculated ones. This is the uterus proper, tube, ovary, submucosal fibroid, and one that's in the meat of the uterus. Here, let's get rid of that screen. And so here's something that's kind of important to me that I have noticed is that I get so many of my patients, and I'm sure Dr. Johnson does too. He's kind of hanging around. I'm going to bring him in a sec. But I want to bring this screen up because I need everybody to know who's watching this now and who may watch this as a lecture in the future that early intervention is going to be your best bet at healing fibroids. Here, let me show you this one screen. So I'm going to share again. And I have, so look at this slide here. So women are waiting entirely too long to get treated. So what I'll see is a woman who has a fibroid like this big. So that fibroid didn't start that way, right? It actually started like this. And because of that, because it takes so long to grow, you don't start feeling symptoms until it's about maybe yay big. And then you'll go to your OB and they'll say, oh, it's not that bad. Here, let's put you on the pill. Let's do this, let's do that. But not actually try to treat the fibroid because they don't want to have to do the things that are necessary to actually get you better. Women report waiting on average about 3.6 years from the time of symptoms. So think about it. If you start here, asymptomatic, that means you don't feel anything. Then it's like here, 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 here. And once it's maybe about here, it really depends on where it's located, you might start feeling symptoms. Then after that, what happens over those 3 years that you're trying to figure out what to do with the fibroid, you're going to different doctors, it keeps getting bigger. My whole goal in treating fibroids is to get early intervention. And a lot of problems that people are afraid their fibroids are going to grow. They're afraid they're going to need a hysterectomy, they'll miss work, all these other things. And most women do not want a hysterectomy. But what we know is that all fibroids generally do is grow. So if you're diagnosed with a fibroid and your doctor says, you say, you know what? I'm going to grab myself a tasty beverage. I'm going to watch this video. I'm going to go see Dr. Nicole and Dr. Pierre, and we're going to figure out what we can do about your fibroids. Here, let's get rid of this. And let's go through. Oh, where's Pierre? Hey, Pierre. Here, let's put him on. Hi, Dr. Johnson.
Hello. How are we doing?
I think we got a better way to do this. Don't worry. I think we got a better way to do the streaming. This looks better, right?
Much better. Much, much better.
Okay, good. Hallelujah. So, Dr. Johnson, tell us a few myths that you have heard from some of your patients about fibroids.
Oh my God. What's one of the most frequent?
What have they tried? And
yeah, it's you know,
I get blackstrap molasses.
Not eating red meat will stop it. Like I've heard pretty much everything that you could take under the sun to shrink them. I heard that like if you do, you know, certain sexual activities or certain things that you're more prone to getting them. I've heard, you know, pretty much that, you know, if your mom had huge fibroids or didn't have fibroids, that's going to dictate whether your fibroids are big or not. If you have fibroids at all, you can't get pregnant. You know, I've heard just about everything. It's just so much misinformation. And like you were saying, because it impacts African American women more than anybody, I think the research on them has been, you know, lackluster to say the least.
Oh, completely. Well, I'll tell you what I have seen a lot of my patients try. They have tried castor oil packs. And they're like, it's like, I don't know what they do. It's like castor oil, you like put it on there. Yeah. And I mean, it's kind of like putting Vicks on there. You know, you may as well. I mean, it might feel tingly, but it's not going to do anything. Another thing I've actually heard people use is like apple cider vinegar.
I've heard that.
Have you heard that one?
Heard that. I've heard them cut out just everything out of their diet.
What's the other one? Huh?
I've heard them cut out everything out of their diet. I'm like, you know, just because you steak is not feeding the fibroid. Like,
right.
Come on.
Right. Milk does not feed your fibroids. So if you're not lactose intolerant, there's no need for you to stop eating dairy. Right. I love a good steak. And becoming a vegetarian is not going to make your fibroids go away.
Not at all.
I have heard I've heard a woman say, oh, well, my fibroids went away, I became vegetarian. Then I have other patients say, well, I became a vegetarian and nothing happened, because we don't have any data to prove whether or not these things are going to work. Oh, I had some other woman get traditional Chinese herbs.
Yeah, I've heard acupuncture. Yeah. That's the new thing, acupuncture. And I tell people all the time, it's just like, if we,
it might help your back pain.
Yeah, it might. It definitely will. It's not going to do anything to your fibroids. Sure. And I tell my patients all the time that, you know, I could put my name on anything and it will sell. Like if I just say this magic elixir is going to do X, Y, Z, you know, people are going to buy it. And I just tell them, like, you know, you have to be very careful about what people are trying to sell you and what they're claiming. Just like they were claiming about the, what was it? Those new sanitary pads that were supposed to cure cancer and stop bleeding, stop pain. I was like, come on, what are we doing here?
But that's where people like you and me and other physicians, we need to get the word out and make people understand that we have science on our side.
Absolutely.
So let's use the science to make your fibroids feel better. Absolutely. So I'm going to go over a few medical treatments. What have you used? Because I've been using, well, of course, we keep people on the pill, but I've actually used Orilisa a little bit. Mm-hmm. And I'll probably write all this stuff down after the lecture's over, like some of the things that we've been using. And there's actually a new FDA-approved medication. I'm not supposed to say the name yet. Mm-hmm. But it's based on Orilisa.
It's actually another a medication that I learned from Dr. Lee that he's giving patients that we learned about in medical school that you can only get in Canada. That's not FDA approved. What is it? Uloprosto?
Oh, yeah. Uloprosto.
Yeah.
That one you can't get it in the United States, though. It's
correct.
Really
you can get it in Canada. You can get it in Canada.
So I tried to start some patients on that, and I had them going, they were trying to get on the website and all this stuff, and it was such a pain in the ass to get, excuse my French. So they kind of just had to just let that go. I wish they would come up with in the States. They would really be wonderful. But then I also start to wonder, is keeping a patient on drugs for all this time, is that really useful, or does it actually feed the corporations? Like, you could really cure diabetes, but diabetes medications is too profitable for corporations. So then why cure diabetes?
Right.
That's what I've always thought about these kind of chronic fibroid medications. I mean, they do work, but you're going to get to a point where you have to do something definitive. So that's what we're talking about, huh?
And that was my biggest thing, especially like with the Uloprosto, is like, the point of it is to get the fibroids. It's the only one that I've heard that actually will shrink.
Exactly. Pierre, you're breaking up.
These patients with these oversized uteruses that are not good for laparoscopic surgery. If you can get them down some, using it as a conduit to get to a laparoscopic surgery, that would be my only interest in it.
Right, exactly. Here, I got it here. I'm going to do stop sharing. I'm going to do another share screen because here, I think, where'd it go? Here, cancel. I kind of want to go over a few surgical options because you kind of talked about doing a laparoscopic surgery, but I also kind of want to talk about something that you and I are pretty well versed in, and that's the Acessa procedure. Here, share screen. Here, let me see if I can make that work. Here we go. All right, here we go. So I think you're going to stay on the screen too. Are you still there? Okay, great. You're still there.
Perfect. Look at you. Look at you.
Working it now.
Working it.
It's you know what? It's the Brown Winery. That's all I can say. So what this is radiofrequency fibroid ablation. Now, not that many doctors know how to do this because, truth be told, it's actually not easy to do. And that's why a lot of doctors will either poo-poo it and just say, you're going to end up needing something else anyway. And I go, you know what? Here's my thing. If I can catch you before your fibroids are 10 centimeters, we're talking like baby head size or little cantaloupes and all those kind of fruits. If we can catch it when it's like an apple orange kind of thing, then we're going to be able to shrink your fibroid to a size that it's basically asymptomatic. Now, you show up to me and you have this or this, then we're kind of in a bit of a pickle. And I've kind of toyed about if I'm going to show pictures of actual fibroids in this lecture.
Why not?
Oh, I got a few. Oh, I
several.
definitely got a few. So we'll put some pictures up. But this is what Acessa is. It's a laparoscopic surgery. And we use focused ultrasound to find each and every fibroid. And what we do is, that's step one. That's a little handpiece that you're going to see in the upper hand corner of the screen. Of course, they made a white guy do it, but whatever. I'm all right about it. He was a stock photo. Then we have, this is what happens.
You better not say that too loud at home.
Oh, well, He's ethnic. Anyway, back to the next thing. Here we go. So once we find each fibroid laparoscopically with an ultrasound, we take this little big needle and then we deploy these other little needles to it, and then we burn it. And that we burn it for like 10 minutes, 15 minutes, depends on the size of the fibroid, and then that's it. Very little blood loss. Everybody gets to go back. You go home the exact same day, and you're back up and at 'em doing whatever it is you were doing, except for like CrossFit or, you don't want to go climb anything, in about 5 to 7 days. Here, let me see if I can get rid of that. Okay, great. So here, what's that other thing I wanted to share? I have one more thing I want to share. Pierre, you good?
I'm good.
Okay. Here, I think I have one more thing I had wanted to share. Here, let's see if I can find it.
Another thing that I want to talk about.
Yeah, go ahead.
That I try my best not to be disparaging about any procedures, but just from my personal experience, we hear so much from a commercial standpoint about UAEs or uterine artery embolizations.
Yeah.
And I tell my patients all the time, I'm going to offer you it as an option because that's my duty as a physician. But I've just had nothing but horrible outcomes, and I've had to deal with such mess with UAEs. But it's patients, they see this on hear it on radio and see it, and it's just like
they have better marketing than we do.
They sure do.
But in fact, get this, I just had a patient who they did a uterine artery embolization at Northwestern. I had done Acessa on her, and then she got pregnant like 2 seconds after I did the Acessa. Unfortunately, she miscarried, multifactorial. But then they did a uterine artery embolization on her after she delivered, and the fibroid that I treated is now trying to come. She's trying to deliver it out of her body right now.
Oh my God.
So that's what I'm going to be working on tomorrow, is trying to figure out how to get this fibroid out of this woman without opening her up. Because that's what uterine artery embolization does. And you're right. I don't want to disparage it, because for some women, it might be a really great option. So there are other options, right? But we're here to kind of talk about alternatives and like get the word out there about the good news that we have. We got to spread the good news. Now here, let me show you here. Wait. I'm going to show you this one other thing here. I'm going to go share screen. And this is not the biggest one, but I just happen to have this one. This was one that we did when we were, it's not the biggest, of course, but it's not too bad.
That's nice.
No, we've done bigger, but I didn't want to gross anybody out. So that's one of our fibroids that we did. So if anybody is watching this right now and you can feel something, especially like in your lower belly like that, please come see myself, see Dr. Pierre, because what we want to do is get ahead of it before it gets to this size. Because once it gets to this size and bigger, and I've done one the size of a watermelon, there is no minimally invasive, beautiful laparoscopic surgery that we can do for this other than just take it out physically.
And then they'll still offer UAEs for that, you know, and it's just like, you know, it's they don't have a size. Well, I haven't seen like size limitations for them. They'll treat it like that, and it's just like, you know, I had one patient that really sticks out in my mind. She had a UAE, and was just 2 years later she was just such chronic pain. I mean, just horrible pain. And I went in and actually did a hysterectomy. She was fed up, but you know, when I did the hysterectomy and you cut into that fibroid, it was just this nasty caseous material that was just like, this is why you're in pain. I mean, this thing just, half of it died and it sloughed. It couldn't phagocytize. It was just there. It was causing you horrific pain. And it's just like, if you're not going to actually, you know, treat the tissue and just suffocate the blood supply, that's painful.
Right. Oh, so I have Jennifer on, and I just sent her a message back. Jennifer's one of the patients I actually performed a CESA on. Thanks, Jennifer. Here, let me get rid of this giant fibroid photo because it looks pretty gross. But she actually used DIM. Now, I'll tell you one thing about DIM. DIM is diindolyl methane, and the way that it works is it helps to metabolize estrogen more efficiently. Now, I don't believe that DIM alone is going to shrink your fibroids to nothing. However, I have had some experience, and unfortunately, when I went to UpToDate, when I went to Google Scholar, just basic searches, I couldn't find enough information that I could say, yeah, this might be something that I want to use. But I have actually started to go, you know what? If you want to give it a try, if you're going to try any of those herbals, then try that one. And then we'll kind of follow you up, and then we'll see if you get better. Because the only way we're going to know is if we actually do a study. And that's what we should do. But of course, like you were talking about, we don't get enough funding to study things that happen in women, and specifically African-American women.
Absolutely.
So does anybody else have, somebody wrote, Faith wrote, okay, here you go, Pierre. What if multiple fibroids have caused an enlarged uterus? Is it too late to treat them? So Faith, thank you so much for asking that question. And the answer really is, it really depends on the size of the organ that you're dealing with. If you're talking about something like this, then of course not. But once we're getting to, you know, pregnancy size, so what we would want you to do, Faith, is come see one of us. So Dr. Pierre is in the south suburbs. I'm downtown Chicago. Come see one of us. We can scan you, and then we can kind of work together to say, okay, how big is this uterus? What do we need to do to make sure that it's not too late for you? But now that you're watching this video, you're going to tell your friends. You're going to say, hey, you know what? If your fibroid's only this big, don't wait on it, because all it's going to do is grow. That's really my take-home point about all of these things.
And that's another thing that's an advantage to Accessa. You know, it's when you have numerous fibroids, like people are very alarmed and scared about it. But Accessa allows you to treat. It's a minimally invasive option to treat multiple numbers of fibroids. You know, because laparoscopic surgery, when you have, you know, a ton of fibroids, becomes very difficult, especially when you have small ones that are, you know, that may be hard to find. But with Accessa, you can find these fibroids and treat them effectively.
Yeah, the one thing I do like about Accessa is that I can actually go, what I'll do is I'll go directly from the top of the uterus all the way through, because if there's a fibroid up here and there's a fibroid down there, people are afraid to kind of keep going. I just go straight down, and we can get to every single fibroid safely. And that's really the most important thing, and allowing my patients to get up and go home without having this big ass scar, excuse my French again, and stay in the hospital for days and have a recovery like a C-section, which is really, really miserable. Let's see. I don't think I have any other questions. Renee asked what was the size of the fibroid that I showed. I think it was like around 20 centimeters. I'd done one. My biggest one, I think, was around 40. Like it was like a 40-week size, it was like a baby. Jennifer's asking one more question before we head out. I know we went over it. What about the calcified ones treated? Like we said, calcified fibroids have already kind of started to convert to a form of stone. Basically, that's calcium. So it becomes more of a deposit. So treating it, I have treated them, but I only get a very, very small amount of shrinkage with calcified fibroids because they kind of already, taken care of. What about you, Pierre? I mean, Dr. Johnson.
I've had success with it. What I did learn and where I changed my approach when I went to the advanced course is when treating with Excessa, just taking the fibroid in smaller segments as opposed to ablating a large, like an 8 centimeter size, do multiple 1 to 2 centimeter
all
ablations
around.
So I've had much more success with that.
Great.
Which is another approach to it. But I guess in answer to our question, the calcification, it is a deterrent, but it's not something in which you can't treat. I definitely think it's worth treating.
Wonderful. Well, it's 7:30. I just kind of want to I like to do a little bit of a wrap up. Thank you so much, Dr. Johnson, for joining us.
Absolutely.
And so things that we know work. We know that birth control does work, and I know a lot of people don't want to do that. We also know these are things that we know work. Lupron does work, but it's really, really miserable. We know that Orilissa and Ulipristal, we know they work. These are things that we already have science behind because the science says these things are working. Other things that are kind of somewhere in the middle do include DIM. Chasteberry is another one I give for my kind of my PMSE kind of patients who are bloated, all that from their fibroids. It does help some. And then the things that don't work. Okay, let's go through that for real. Things that don't work. Apple cider vinegar doesn't work. Becoming a vegetarian doesn't work. Veganism, if you like it, fine, but it's not going to help shrink your fibroids. Getting rid of dairy doesn't work. So if anybody has any questions or anything like that, feel free to reach out to us, and we can't wait to see you in our office. Again, I am Dr. Nicole Williams, and this is Dr. Pierre Johnson, and we're going to say, cheers, Pierre.
Cheers.
Thanks, everybody.
All right, everybody. Bye. Have a good night. Bye-bye.